Now, the next element after this, we are going to visualize now the clinical presentation of a patient with premature rupture of membrane and preterm labor. So we start with the preclinical presentation of premature rupture of membrane. Is it clear? So generally, a patient that has premature rupture of membrane is going to present with a perivaginal gush of fluid. Is it clear? She presents with a perivaginal gush of fluid. Is it clear? And that gush of fluid, the characteristic is that it's going to be copious, and you're going to have the amniotic fluid characteristic too, provided the patient is already having complications that we're going to visualize later, like acute fetal distress. It means that the child is going to have meconial stain amniotic fluid, provided that the child there are other complications with the perivaginal gush of fluid like cord prolapse or a placenta abruptio. You are also going to visualize a amniotic fluid which is going to be bloody stain. Is it clear? So all these are the elements that you must visualize. You have a patient that presents with a perivaginal gush of fluid during her gestational age of greater than 28 weeks of gestation, and it is less than, and she has not yet started labor. Meaning that what? When we say that the woman has not yet started labor, it means that what? Every time that you are taking the history of a patient that is having a premature rupture of membrane, in the history you try to visualize actually that there is a perivaginal gush of fluid, and from that perivaginal gush of fluid you should distinguish the disease which is premature rupture of membrane from the differential diagnosis of premature rupture of membrane. That's why now we are going to ask you need to ask yourself, what are the differential diagnosis of premature rupture of membranes? The first differential diagnosis of premature rupture of membrane is sperm. Is huge sperm. Is it clear? But that should be placed at the last position. Is it clear? So you have much sperm inside a vagina. It can be one differential. So if she tells you that she realized that immediately after sexual intercourse, you can just guess that the patient was having sperm instead and not vaginal gush of fluid. The second element is urinary incontinence. Is it clear? So that's why you need to test. So these are the questions that you have to ask. You have to ask us if she is usually having these irritative or urinary symptoms. If the patient usually have irritative urinary symptoms or obstructive urinary symptoms, in order for you to distinguish if the problem is coming actually from the genital tract or from the urinary tract. So all that comes from your review of system. The third element after that, you have also the cervical mucus plug. The cervical mucus plug. Is it clear? Now, the cervical mucus plug can be another element which can be associated with that. Is it clear? Cervical mucus plug is another element which is associated with that problem. Is it clear? So after the cervical mucus plug, the fourth element, we have also rupture of the chorioamniotic sac. You have a sac which is the chorioamniotic sac, which is between the chorion and the amnion, and that is not actually the amnion. Is it clear? And then the fifth element is a gravidic hydrorrhea. Gravidic hydrorrhea is just the liquid that pregnant women are going to have as discharge. The pregnant women generally have plenty discharge because of progesterone production in pregnancy. Basically, so those are the differential diagnoses that you should have in mind. Generally, in a patient that has a perivaginal gush of fluid, which is as from a premature rupture of membrane, it is going to be copious. That is the major characteristic, and is going to be watery in character. So those are the major characteristics that a patient that has premature rupture of membrane is going to have on your history. Now, on the physical examination, is it clear? What are the elements that you try to bring out on physical examination? Still looking at the SchrDbb algorithm, you have the disease, the differential diagnosis, the endemic disease, you have the cause, the complication, and the background. Is it clear? So now you have already bring out the history. So in your physical examination, how do you bring out the diagnosis of the disease? You need to first know that what you are going to do on physical examination is vaginal speculum exam plus a Valsalva maneuver. Is it clear? In order for you to visualize premature rupture of membrane on physical examination. So actually, let's think that this is at the labs of a woman Is it clear? So what you are going to do is that you are going to have a vaginal speculum exam. You are going to place a speculum, is it clear, to visualize this cervix. Let's say that this is your speculum here. These are the two blades. This is the upper blade and this is the lower blade. Generally, when you have a pregnant woman who has already multiple pregnancy, we use the speculum called the Smith's speculum. Is it clear? The Smith's speculum is the one that is going to have this curve as such here like that. Is it clear? This is a Smith's speculum. Is it clear? You see it's having a big top and a big down. This is mostly used in the cases where you have a patient that is that has a multiple, that's already multiparous. Is it clear? Now we have also the other speculum, which is the cusco speculum. The cusco speculum is the one which is going to have the straight blades. Is it clear? The blades of the cusco are going to be more straighter than in the case of the Smith speculum, and the cusco speculum